To begin with the introduction for tonight, welcome everyone to the February installment of the Katherine Kerr Vital Energy and Health and Healing lecture series, where we explore the potential for various forms of vital energy healing, such as Tai Chi Chuan and Qigong, from a variety of perspectives, from humanistic studies, social scientific studies, from the views of practitioners themselves. And this year we've been looking at clinical and scientific research to try to see the amazing potential that these techniques have for improving human flourishing and well-being across the board. And it's my great pleasure tonight to invite Dr. Byung-Sung Oh, who is an associate professor at the University of Sydney, so coming to us all the way from Australia, and is an integrative oncology practitioner using evidence-based complementary medicine with clinical and research interests in lifestyle medicine, such as Tai Chi and Qigong, acupuncture, and gut health, including the Oncobiome. Upon completion of his PhD at the University of Sydney, he undertook further postdoctoral research and clinical experience at the Dana-Farber Cancer Institute, Harvard Medical School, and it currently works at the Mater Private Hospital at the Royal North Shore Hospital, and in Genesis Care in Sydney, Australia. So both research and practice. Dr. Oh is an academic researcher, having published numerous journal manuscripts, and is conducting ongoing research and teaching at RNSH and at the University of Sydney. So again, it is my great honor to invite Dr. Oh to come and speak to us tonight. Thank you so much for coming all the way from Sydney.
Thank you for kind introduction. First, I'd like to thank Larson for kind invitation to give a lecture at your prestigious institution tonight. And okay. Yes, today my topic is Tai Chi and Qigong in medicine. So opportunities and challenges. So a lot of people in community, they practice like a more socializing or some as an exercise. But recently, a lot of people done the research in medical field, and then they know that there's a lot of evidence, but we are not sure how we can introduce Tai Chi Qigong in medicine. So I will discuss about opportunities and challenge, and maybe later I will give us some proposal what I'm doing, and I will appreciate your comments so I can improve my proposal as well. So my talk will briefly cover today, brief history of Tai Chi and Qigong, and is Tai Chi Qigong is exercise or medicine? Or if there's medicine, if there's enough evidence, and discuss about opportunities and challenges of the clinical application of Tai Chi and Qigong, and also barriers of introducing Tai Chi Qigong in Western healthcare system. I think I will skip, will not go too much. I saw that your previous speakers have discussed more detail about the history and philosophy, all detail about Tai Chi and Qigong. But we briefly discuss about I'm stuck with my PowerPoint, I'm not sure. Sorry, I lost my PowerPoint sharing. Sorry, they was a little bit lost.
It looks like it's working now.
Okay. So that we know that Tai Chi Qigong theory and philosophy was early 2000, almost 3000 BC. They discussed in Huang Di Neqing, which is a traditional Chinese medicine classical textbook. They already mentioned that they use the term Yang Sheng. So that means self-cultivation practice aimed for personal health and longevity. So they already mentioned in medical, the textbook more than 3000 BC. And later, there was discuss about Qigong and Tai Chi. So Qigong is that from part of traditional mind-body exercise, was a spiritual exercise practiced more than 5,000 to 7,000 years ago. And then it's already shown that certain Ma Huangdi grave, they can depict there was certain movement, so that we know that people practiced many years ago. But in many of the Tai Chi and Qigongs, there's a major two different categories. One is internal Qigong and the other one external Qigongs. So internal Qigongs, people practice themselves and more like a mind-body medicine approach, including meditation and relaxation. But external Qigongs, people sometimes, Qigong, they call them Qigong practitioners. They practice Qigong for many years, and they have a certain Qi power, and they're trying to emit a Qi for healing. So this is additional traditional Tai Chi and Qigongs. But for the meantime, modern science, they're trying to conduct the research, and they found there's no good evidence in external Qigong this time. But I'm sure in the future research with the new technology, maybe they can find some evidence in the near future. But for the meantime, because we are working on in the medical environments based on evidence, we are more focused on internal Qigong and Tai Chi. So then what is Tai Chi? There's a subtle difference with Tai Chi and Qigongs. I'm sure you're aware. So the Tai Chi is more variety movements. So there's certain forms you learn and you practice together. And then most of people generally practice in the group therapy, group practice in community. And then there's Chen style, Yang style, Wu style, there's many different styles. And also Tai Chi and Qigong common, there's common things, common essence, Tai Chi and both of them are gentle, mixed up gentle exercise and meditation. Repeat again, many people, they're asking Tai Chi's exercise and medicine because of the community, like a fitness center, they introduce as exercise program. But in most of integrated medicine cancer center or some other the well-being center, they introduce a part of healing or exercise medicine, more therapeutic efficacies. So now we'd like to ask them, Tai Chi's exercise. Yes, it's part of exercise, low impact exercise, which we can improve flexibility and build the strength. And if they Tai Chi's exercise, then we know that exercise is medicine, isn't it? So a lot of people, they recommend exercise is medicine. So these days, a lot of doctors and healthcare professionals recommend exercise as medicine. But that means sometimes when you say medicine, exercise, this is a very good idea. But for example, patients, sometimes they are not sure how it works. So that now a lot of research, people done research and they show that how does exercise can work, for example, in the cancer area. For in here, can you see when the people who has less physical activities and they have a lower grade inflammation in our body and they have inflammation. This is the where the small particles show them inflammation. And then when they do physical activities, then they reduce inflammation, they improve more like an immune cell, an NK cell or a T cell. And when they continue exercise, they improve. So when they do exercise, when they increase NK cell, immune cell, they can come to outside blood vessel and they're trying to attack the cancer cells so that they can also improve cancer symptoms. So that means they can create efficacy in addition to the standard care. And again, if they continue exercise, they can also prevent cancer treatments. So this is based on this, they propose approach for example, patient before the treatments, and then they can use exercise, they can recommend, that means they can do this, and then it can also potentially they can improve quality of life and medical symptoms. And also during the treatments, and sometimes a lot of people, they say, I'm very tired and fatigued, so I cannot do exercise. So I saw proposing Tai Chi Qigong is one of the low impact, very gentle and soft exercise. So we can recommend this stage. And also after treatments, people in the survivors, and then also gradually, when they're tired, difficult to do normal activities, but starting from the gentle exercise and gradually back to normal physical activities, and they can prevent cancer and improve many medical symptoms. Then if Tai Chi Qigong is medicine, then does it have enough evidence? Yes, many papers, previous research showed that Tai Chi Qigong has a potential to improve many medical conditions and quality of life, people with chronic disease like arthritis, cancer, diabetes, fatigue, hypertension, and pain. And also recent research showed that Tai Chi can improve a lot of psychological symptoms like anxiety, depression, and also that this is for elderly people, balance, and sleep, stress management, even the Alzheimer's and Parkinson's disease. And then this research done at the 2016, we call them evidence map of Tai Chi and Qigong. This part of the data for Tai Chi is a lot of research, the number big, that means the number of study. And then we see on the right side, there's a strong evidence, mild to moderate evidence, and no evidence, inconclusive. And it showed that there's many research and show that Tai Chi and Qigong has a good evidence. And latest research conducted last year, it showed that, there's more than thousands research they're coming up in the, when you go search in the PubMed, but they evaluate with the randomized clinical trial, and they like to see Tai Chi Qigong evidence in the clinical outcomes. They found that more than 680 studies, and it showed that more than 400 studies show potential positive impact. And then more than 200 studies show positive impact. And then only a small portion, around 20 studies show that inconclusive, and one study showed negative impact. So that means we know that Tai Chi has many good scientific research they conducted the last 20 years, and then show positive impact, and only small portions show that not conclusive or no impact. So this is one of the good papers, because most of medical doctors will not read the complement medicine papers, or sometimes they are busy, they are not checking the PubMed in the Tai Chi, they are reading more like a chemotherapy or radiotherapy. So now we see when you go to a high impact journal like a JAMA, a lot of people they read. So that one of the latest research published, it showed that Tai Chi and the effect of Tai Chi on the sleep in elderly people. There was 3-arm study. This is very good study and showing that the 3 arms with the control, exercise, and Tai Chi group. And then it showed that after the Tai Chi intervention, they measure outcome. So insomnia remission rate and treatment response rate. It showed the 3 groups. This is the one Tai Chi group, this is exercise group, and this is control group. So compared to control educational group, or no intervention, the people Tai Chi group showed a significant impact improving insomnia remission rate. Same again, response rate, we can see same trend. So not only they see the post-treatments, also when they follow-up, long-term follow-up is show on a very similar trend. So latest, I think 2 years ago, latest research showed that in one of the research conducted at Tufts Medical School, Dr. Chen Wang, he showed that they conducted the research with the Tai Chi for fibromyalgia patients. They also found that they can improve the fibromyalgia symptoms and quality of life and reduce pain as well. So when they do for the more physical symptoms, but also there's many, as mentioned earlier, many research conducted with the psychological symptoms. So like they're trying to improve the stress outcomes and the anxiety, depressions, mood, and depression symptoms. They conducted the meta-analysis. When the several studies they include, so when the right side, they show them positive impact. So that means TAICHI showed a positive impact on stress and also anxiety and also depressions and all the mood swings. So while previous research done for some research on more outcome measure with the subjective outcomes, so a lot of scientists and the doctors, they wanted some objective measurements. So this is one of study they done for impact of TAICHI on antioxidant, and it showed that TAICHI can improve impact on the antioxidant level. So after they compared the people normal walking and then TAICHI and control group to usual care, and they show them TAICHI group, they can improve antioxidant level. And then also same time when they improve antioxidant level, they reduce oxidative stress. So you know that stress is they are more damaging our body in the DNA level. So they're causing a lot of medical symptoms. So a lot of people, when you go outside, they're looking for the health food shop, or when you go to the market, when you say like a blueberry or when you say berry, they call them antioxidant food, and price is very high because they like to promote protect their body. They're trying to keep healthy their body. So when you say antioxidant, they are very effective. I mean, a lot of people, they pay for the food, but now if you practice TAICHI, it shows that also they can increase antioxidant level. So in addition, during the last 2 years ago, when there was a COVID time, I conducted a TAICHI effect of TAICHI Qigong on immune response. And then we collected many studies, and it showed that all biomarkers related to immune response show them they improve the immune function here. So that means during the COVID time, we recommend to many patients, maybe in addition to whatever your usual care, if you do gentle exercise, meditation, relaxation, this combination TAICHI Qigong can improve your immune function as well. So based on this, our previous research, and then currently I'm conducting research project and effect of TAICHI Qigong on gut microbiome in people with cancer. So a lot of people, they was working, what is gut microbiome? So the latest research showed that gut microbiome is associated with the cancer treatments. And also this is the latest study conducted in the MD Anderson, and then we show that during the immunotherapy, certain change of gut bacteria, some people respond with immunotherapy and some people not respond to immunotherapies. Then later, some people, when they change their gut microbiome, the fecal microbiome transplant, and they can show some people was not responding, and now they can change the efficacy. Some people now responding. So that means we know that gut microbiome is very important in the treatments of efficacy of treatments. So now, so that this is reason, but a lot of research more focus on the like probiotics or food and diet, but not so much study done with the physical activities. And of course, sometimes there were already some study before intervention, some study measured with the physical activity like normal gym exercise, like resistance exercise and more athletics, how they difference with the normal population and the who are physically active on party, they found that microbiome there's a big difference. So that, but we know that Tai Chi Qigong gentle exercise can improve gut microbiome. Also, this is one of my research. Around 10 years ago, I conducted and prepared and presented the patients. So I will give a talk about my study, impact of medical Qigong on quality of life, fatigue, mood, inflammation in cancer patients. So we measure the program was made of gentle exercise and meditation, relaxation, and so when we Qigong. So we include the cancer patients diagnosed of cancer over 18 years age, ECOG scale 0 to 3, and then people expecting survival time more than 12 months. And inclusion criteria was psychiatric disorder or medical, the medical condition that are not allowed to exercise, or some people currently using the practice Tai Chi Qigong. So we recruited 162 patients at the 3 university teaching hospitals, and the mean age was 60 years old, and 70% of people were married or defect, and more than 70% were more Anglo-Australians, and then almost 6% was a female. So we recruit the patients, we randomize, and we have 2 groups, one for medical Tai Chi Qigong groups, and one is control group, which is usual care. And then we done for 10 weeks intervention, and we done follow-up. And then when we do intervention is, again, sometimes the people in outside, the people, they're Qigong, there's certain forms or certain Tai Chi form, they follow certain forms. But during my programs, I know that patients, some patients are very sick, some people are normal, they can do normal activities. So we designed the program, very gentle exercise program, integration of deep breathing exercise, relaxation, and gentle movement, including visualization and meditation. And for example, some of the patients are young and some patients are very senior old age. And this is the patients, for example, they are at the time, there was 87 years old, both of them very close age. And then when they approached them, they was asking, I'm very old, I'm getting treatments, I'm very sick. Can you do exercise? You think you can make it better? So I told them, you can try first. And then they initially try 1 week and 2 weeks, and they finished the 10 weeks programs. And later they feel, oh, this is so good. So they're promoting my Tai Chi to all their patients in our hospital. And then when they're moving to, because we are recruiting 3 different hospitals, they follow me and they say, oh, even though I finished the programs, can I continue practicing your other center? So they almost finished their 30 weeks programs. So we measured outcome with the fatigue, FACTF, and the quality of life with the FACT-G questionnaire, and side effects were measured with part of our FACT-G questionnaires. Mood status, POMS, and inflammation biomarkers measured with the blood test C-reactive protein. And also we measure the cognitive functions with the EORTC-CF. So this is the result. We found very significant effect between the interventions and the control group. After 10 weeks of Qigong, people improve fatigue significantly. And also we measure quality of life. The quality of life in the when you use the FACT questionnaire, they measure physical well-being, social well-being, emotional well-being, functional well-being, and total. So you can see all dimension, different dimension. The intervention group with a blue color show that they improve compared to control groups. So in overall, in total, there's a significant difference improving quality of life. So later, we also measure some symptoms. So again, we measure some nausea symptoms, pain, sexual life, satisfaction with sexual life, and sleep measurements. Then again, the higher score means better improvements. So nausea symptoms, they improve. And pain, there's not so much difference. And the satisfaction with sexual life also can show them the intervention was very increased, significant improve, while the other part, the control group reduced the score. And also sleep score, they show them very high improve in the intervention group. So we can see three like nausea symptoms, and then sleep, they improve, but pain, there was not so much difference. So we know them, a lot of people, they're asking why there's not so much difference. Because cancer patient, when they're receiving during the treatment, when they have a pain, a lot of people, they're using pain medications. So when they're both party using the medication, of course, sometimes the medication is stronger than Taiji and Qigong effect. So we cannot detect the difference. But when you see nausea symptoms, of course, even though there's anti-emetic medication, they cannot control 100%. So still more than 50% people are experiencing nausea and vomiting symptoms. So we can, once we do Taiji Qigong intervention, we can see they can improve symptoms. And also again, here, sleep, even though some people, when they have severe symptoms, they can using some sleeping pill, but a lot of people, they like to use a natural way of sleep. So that means when using the Taiji and Qigong, they can improve sleep symptoms as well. Again, in here, quite interesting area we found. We know that during the cancer treatments, there's no medication to improve the satisfaction with sexual life. Also, a lot of doctors, they are not discussing on these issues, but we know that people who practice Taiji Qigong, they can improve this area as well. So in addition to subjective, so that again, we discussed about sexual life, this is satisfaction with sexual life. The baseline, there was already a difference with the intervention group and control group. So this is the way control group, their symptoms get worse, then intervention group, they improved. And also they measured the mood status. This time when the lowest score is showing them better because different way of questionnaires. So then intervention group, most of other dimensions, they lower compared to control group. For example, we measure the tension and anxiety, depressions, anger, hostility, lack of vigor, fatigue, confusion, and total. They measure the mood swing. It showed that most of dimensions outcome show that they reduced symptoms. So compared to all other subjective outcomes, again, we're trying to measure the objective outcomes so that we measure inflammation's biomarker with the C-reactive protein. Baseline was very similar. So after 10 weeks later, the control group's inflammations go up while the intervention is slightly reduced. So that when you compare with the control and intervention group, there's significant difference after 10 weeks interventions. So at that time, 10 years ago, most of the study was more focused on the subjective measurements. So I think this is my one of study was they use the biomarkers with more objective measurement. And then a lot of doctors and the oncologists are very happy. And then since then, our hospital, they introduced the Tai Chi and Qigong in our hospital as a part of integrated care. And then later, when I presented this paper to Society of Integrated Oncology Conference, and then one of my previous boss, Dr. David Rosenthal, who was the director of Integrated Cancer Center at Dana-Farber Cancer Institute, he invited me to do some more research at his institutions. So in addition to that, also we measure the cognitive functions. Also, memory is very important during the cancer treatment. Some people usually either chemotherapy or radiotherapy. Some people, when they're receiving the treatments, in addition to anxiety, depression, people the memory level is very slow. So we also measure the cognitive functions, and later we found that Tai Chi Qigong can improve cognitive function measure with the impact of perceived cognitive impairments, perceived cognitive impairment quality of life, and perceived cognitive abilities. All three dimensions, three items show that significantly we can improve. So my study found that my medical Qigong medicine can improve quality of life, cognitive functions, fatigue, mood status, satisfaction with sexual life, and reduce side effects and symptoms of inflammation of cancer patients. So again, last 2 years, we cannot do normal, there's limited clinical service available. So we provide a Tai Chi Qigong by telehealth. So before COVID, we provided Tai Chi and Qigong as a group therapies. So usually the people every Saturday, or the 5 to 20 people, sometimes 5 people, sometimes 10 people, they regularly coming to Tai Chi class. So they really enjoy as part of our cancer care program in our hospital. And during the COVID programs, we could not do organized group therapies. So I provide some telehealth service. And then when you provide telehealth service, we cannot do individual, the group therapy, because all individuals their conditions different. And then we are not sure how we can deliver safely, because some patients are not comfortable to talk about their own individual condition in front of many people. So we organize personalized the telehealth service, and with 30 patients, and that we found that more than 30 patients who received the telehealth service, Tai Chi Qigong via telehealth service, was very happy, reduced anxiety and depression symptoms. So we know that Tai Chi Qigong can also provide service via telehealth. Then a lot of research shows there's many evidence, and we want to know how it works. Yes, we can discuss in two theory. One is the Chinese medicine theory, and one is Western medicine theory. So in Chinese medicine theory, we call them when there's a free flow of energy in our body, then we are healthy. When there's a stagnation of qi and blood stagnation in our body, that means we develop discomfort and later pain, and later ultimately create a disease. So when we make a free flow of energy and balance yin and yang energy, that means we are healthy and people live long. So based on this theory, when you're moving, when you do Tai Chi and Qigong, we aim to move qi and blood circulation in our body. So in Western medicine theory, we call them, I'm sure the previous speaker, they discussed all relaxation response and psychoneuroimmunology theory and Bhagat theory. And when you see briefly we discuss sometimes relaxation response, they explain like a sympathetic and parasympathetic nervous system activities. One is sympathetic activity, nervous system, they make actions, while parasympathetic nervous systems, they try to calm and relaxation. But is very, when you compare with the traditional theory, like yin and yang theory, qi and circulation theory, very similar yin and yang. When you calm, yin is very calm and relaxation, yang is very active movements. So when we are making balance, then people are healthy. So somewhat very similar, even though they're using different terms, relaxation response with sympathetic and parasympathetic nerve, scientific term, but there is similarities. So later, they're using the psychoneuroimmunology theory and vagal theories, vagal response. So we know that all mind-body medicine, including yoga, meditation, relaxation, including Tai Chi and Qigong, work based on these theories. Then there is much research, but not so much credentialing and privilege that allow integration of Tai Chi Qigong in public hospitals. So then how we can work, how we can introduce. Sometimes a lot of researchers, they do research. The main reason we like to show them some evidence so that we can apply in clinical application to the patients. But there's no, for the meantime, there's limited options, limited institution, they're offering Tai Chi Qigong into their cancer care or medical care. So yes, we'd like to see what is the current barriers introducing Tai Chi Qigong in healthcare. So I just analyzed in 3 different models, business model and some guideline issues, and also policy issues. So current business model in healthcare, even though we understand that prevention is very important than treatments, but current model is most of hospitals and healthcare is more focused on treatments instead of prevention. So even though we learned prevention is very important from the last 2 years COVID outbreak. As you know that in US, when you have a break leg, the cost of the curing bill is more than $7,000. When you stay in hospital for 3 days, it costs another $30,000. So hospital point of view, once you're providing Tai Chi and Qigong, you create income maybe for $100 or $1,000. But when you treat the patients who broken arm or leg or a cancer patient, they make $500,000. So that means the treatments focus on patient who is sick. So that means healthcare, they are not trying to prevent cancer. Even the academic institution, we promote prevention is very important, healthy lifestyle. But we leave the people in the community, we do not actively engage, we are not actively promote and educate them. So most of current healthcare government policies that people get sick. When they're sick, they pay. And hospital, they make a big business. So this is current model. So sometimes we have to consider how we can change. And as mentioned, we learned from the COVID. A lot of people, they know the consumer know that health and wellness, well-being is very important. So I'm sure the demand will be changed. So in addition to business model, also there's certain guidelines. For the meantime, when we say either in a lot of mind-body medicine, even though Tai Chi and Qigong Yoga, sometimes we know that there's plenty of evidence is good for improving many medical conditions, improve prevention as well. But for example, there's no clear guideline how to incorporate, how to prescribe to the patients. For example, compared to the medications, Taiji Qigong, for example, if you're going to prescribe Taiji Qigong for improved balance or arthritis patients or cancer patients, what forms, how many hours, or how long you have to prescribe to improve their conditions. So a lot of people, everyone, they argue. Some people say, of course, when you do research, most of people, they done for 40-minute to 60-minute hour time. And then sometimes with a minimum of 6 weeks to most, some study was 6 months, average was 12 weeks. 12 weeks. That means we know that this is the time frame, but sometimes all individuals, sometimes they have different as well. That means we have to do more research and we have to make a guideline. So make a certain prescriptions, certain patients, maybe they can start from the 5 minutes or 1 or 2 forms initially, and gradually they increase efficacy, the dosage level, same as other medications. Even though Taiji and Qigong exercise is very safe and lower intensity, sometimes based on individual, we have to prescribe different doses and different level. So we have to tell them, Taiji. In addition to that, in outside in community, when you say in Taiji Qigong, a lot of people when see there's one forms. Actually, in the community, there's more than 1,000 different forms of Taiji Qigong they practice. Even though they mention about the internal the Qigong or external Qigong or the Chen style, Wu style, Yang style, different style, and then everyone these days they're creating their own. Also, some people from the Taoist the tradition, some people from Kung Fu martial arts style, everyone has difference. So that sometimes, even though when we're recommending, for example, we start from 5 minutes, gradually increase for 1 hour, everyone has a different intensity as well and different style. So this is another issue we have to discuss in future among our Taiji Qigong instructors and researchers. And how about qualifications? A lot of people, they're looking for qualified Taiji Qigong instructors. Where is good Taiji Qigong instructors? So this is my proposal and recommendations. In traditional model, there's many different forms of Taiji and Qigongs. And small group people, they practice medical Qigong based on the Chinese medicine classical textbooks based on theory and medicine. And so we define what is a traditional Taiji and medical Taiji. So Taiji is a lot of traditional Taiji they learn from different traditions like Wu style or Chen style, whatever style. And people who learn for traditional Taiji and then they train additional, have a knowledge on the clinical aspect of the medicine. And then the people who trained, they can modify based on medical symptoms, their ability to modify the Taiji and Qigong for patients. We call them medical Taiji Qigongs. So this is the current model. People, they practice community, traditional model, more people, and small group of people practice medical Taiji and Qigongs. But in the future, when modern medicine is changing, so we call them integrated medicines. So when you say integrated medicine, a lot of people, they do conduct research in complementary medicine, including Taiji Qigong. So when there is a scientific evidence, they bring into part of standard of care. So that means they transform as a medical Taiji Qigong as part of integrated medicine programs. In cancer care, we call them integrative oncology. So again, as mentioned, I conducted my research. I present in many conferences, and also not only me, other speakers, other researchers, they present very interesting new discoveries of Taiji Qigong. Major question is, many doctors, after the presentation, doctors and nurse and patient, they ask me, where we can find qualified Taiji Qigong instructors for me or for my patients. And then it was difficult answer. Of course, sometimes in outside, someone who's very experienced dealing with the patients who have a medical condition, but a lot of people in community who has the traditional Taiji Qigong is coming from the martial art Kung Fu style or Chen style, or that means very active. And most of also the instructors are very young. So sometimes, for example, one of the researchers who's doing for first prevention in elderly patients, is one of the comment was, he said he gave up. The thing is that young men cannot understand my medical conditions. They cannot understand all the people's, my body. So that means, of course, the instructor cannot understand all individual conditions, but at least if you understand the medical conditions about what is arthritis, what is fatigue, what is the fibromyalgia, medical conditions, and then during the treatment, what they're experiencing, that means they can make a program for personalized, tailored programs. So this is another issue, so that we develop international medical Taiji Qigong associations, and we're trying to, when people evaluate their Taiji Qigong certification and provide the registered Taiji Qigong instructor certifications, then later people can refer their patient to qualified Taiji Qigong instructors. So with a group of 20 academics and the Taiji Qigong instruction communities, master group level, we develop the accreditation standard guideline initiative. We published early 2008, and later we propose, I mean, this is some summary. For example, accreditation standard guideline, we proposing them health promotions. That means people who have a Taiji Qigong experience, they are trained for many years, and they are not trained with the medical, no training on clinical medicine aspect, then we call them health promotion. They can teach like exercise, like fitness center, who are teaching the exercise. But later, if you like to see the patient make a program for patient individual who have medical conditions, we want the traditional Taiji Qigong instructors do some basic training in Western clinical medicine program, 20 hours, 30 hours, or 60 hours gradually, which they are interesting to look after patients, all different area, additional clinical training, and then they understand patients' medical conditions as well as current medications and what is the progress of disease, what Taiji and Qigong can do. So that means people have a more experience, they can help patients more effectively. So we organized the associations, and we organized a conference in first time. And then when I was at Boston, we worked with, I think one of previous, our speaker, Albert Young, is a founding member, and myself and one of my previous director of the Dana-Farber Cancer Institute, Professor David Rosenthal. And then our theme was that we like to transform Asian art, Taiji Qigong, to modern mind-body medicine. So then we like to, first we show them, a lot of people, as well as the patients and medical doctors, we like to show them this current evidence. And then what is the qualified Taiji Qigong instructors, how we can look after patients who have medical conditions in addition to teaching only exercise programs. So if you're interested, we are having this year 5th IMTK annual conference will be held. Initially it was planned to have held in Massachusetts General Hospital, but because of the COVID pandemic is still a little bit unsafe. So that this year we're gonna have a virtual conference in October 22 and 23rd this year. So later, if you're interested, you can visit and you can come for you can attend our conference. I'd like to invite you. And in summary, Tai Chi Qigong has been widely used in community, and research has demonstrated effectiveness and clinical application on several diseases. Demand on qualified Tai Chi Qigong is ever increasing. Qualified Tai Chi Qigong instructors are needed to promote public health and well-being of people in the community. Thank you. So sorry that a little bit confusions and a little bit disruption of the presentation in early stage. So I'm happy to any discussion on my topics.
I think if you have questions, feel free to use the raise hand function, or you can post them in the chat as well, and we will read those out. Yes, Lita, please.
Hi, thank you so much, Dr. O. That was a really fascinating presentation. I'm currently a postdoctoral student at the National University of Natural Medicine in Portland, Oregon, and I am currently trying to develop a protocol for Qigong or Tai Chi for people with multiple sclerosis. And I'm preparing a survey to send out that includes qualifications of instructors, frequency, duration, forms, and things. So what you're identifying with your institute sounds really appropriate. So I really appreciate that. There's a lot of work being done on gut microbiome in our research lab. And I was just curious about your research in that. And do you see that as a potential mechanism for explaining some of the benefits of Tai Chi Qigong as that has been used, is becoming used to explain benefits to immune system and neurological conditions as well?
Yep, thank you so much for your comments. Yes, so that as mentioned, Tai Chi Qigong in research area, when you conduct the research, always one of the issues is who is the qualified Tai Chi Qigong instructors. And sometimes the researchers, they are not sure. That means they are looking for someone, their recommendations. Of course, sometimes if you know that some person, you have a friends who experienced in the Tai Chi style, or Yang style, or Wu style, different style, they recommend you. And sometimes some programs, as mentioned, very active, like martial art, back close to martial art. Some are very soft and gentle, more like Yang style. But even those, for example, in the cancer, when I'm doing all this research item for Qigong research, and people ask me, why don't you do intervention with the Tai Chi? Yes, some patients during the cancer treatments with the chemotherapy, and other people, they are very sick, and they call them brain function foggy. Memory is not good, very anxious. And then when you go Tai Chi, you have to remember one form by one. And the people says, oh, I'm tired, I'm more stress. You're giving more stress instead of making relaxation. So I choose Qigong movements. Even though in all the 1 hour program, I made 24 movements, Qigong movements, but I start from 1 or 2 movements in first week. And second week, we gradually increase 3 movements and 4 movements. As long as you learn the movement and relax and happy, we move next movements. We don't want to push you follow this form for 24 forms and repeat every day. And that's too much for them, for beginners. And they get more stress in the beginning. So this is the approach. And then also you mentioned about, great to hear that your university, your institution doing for microbiome research. Yes, microbiome is very hot topic in these days, not only for the cancer, it's all many diseases, including physical and even the anxiety, depression, mental health as well. Now it's coming to cancer. So that, as I mentioned earlier, early stage, they're trying to see the association between the gut microbiome and disease. They found that many people have arthritis, diabetic, including cancer. The structure of the health patient with the disease group have a different diabasis in diversity, and then all the different structure. And then later, when they done for a lot of research done, animal research, they show that once you change the gut microbiome, they improve many medical symptoms. So then later stage, they show them they can fecal transplantation, they increase efficacy of treatments. But only thing is that sometimes each country, each individual has a different diet style, different culture, different stress level, different anxiety. Many things, there's many factors influencing gut microbiome, not only one single food. So then that's why our institution, initially, we done for a lot of research review, as well as we are measuring the patient have symptoms or no symptoms during the treatment with medical side effects or less side effects. And then in the future, we'd like to do some other intervention, but we know that Tai Chi Qigong, a lot of people outside, they already recommend Tai Chi Qigong is gentle exercise. So my area is, as mentioned, Tai Chi Qigong, gentle exercise. We can apply all the either, doesn't matter, young people, elderly people, either sick people or reasonably well, we can apply to all. So we believe Tai Chi Qigong improve gut microbiome. So for the meantime, many research show them how it works, either the traditional model or the relaxation response or psychoneuroimmunology theory. In the future, we'd like to show them gut microbiome theory, if we can prove Tai Chi Qigong. I'm happy to work with your institution. Maybe we can do later, we can move some exchange collaboration opportunities, and then happy to extend in this area. Thank you.
I think next was Chen Ying. Please feel free to ask a question.
Hi, I'm Chen Ying. I'm a PhD candidate from sociology from National University of Singapore. I just submitted my PhD thesis. My research is about relationship between Qigong medicine and the patient organizations. So thank you for your presentation today. My question is, what is the difference between Tai Chi and the Qigong in terms of the health benefits for the cancer patients? And also, I'm curious to know in practice, when you meet those cancer patients, why some patients, they choose to practice Qigong, why some others prefer to practice the Tai Chi. So because for from my research, I found that cancer patients tend to prefer Qigong, especially Guolin Qigong, because there are a lot of those cancer patients. They kind of very systematically provide Qigong as a way to combat with cancer. Yeah, that's my question. Thank you.
Thank you so much for your very important questions. And then this is very important issue as well. As I briefly discussed in my talk, mentioned that there's many thousand different forms of Tai Chi and Qigongs. Sometimes, of course, some patients, as mentioned, we have a close friends who say, oh, I'm going Tai Chi, I'm really enjoying this, really good. Then the people will join the programs. Of course, sometimes in your hospital offering the program, if there's many programs, people can try all different programs and they can choose. But sometimes they made limited option. There's only one program. Some institutions offer only Tai Chi, some institutions only Qigong, and some they're combination both. Sometimes people have no choice. Sometimes there's a choice. There's one thing how the people can access. And then also the researcher's point of view, also clinical practitioner point of view, you have to understand, we have to analyze what is Tai Chi and Qigong. As I mentioned earlier, Qigong is more continuous movements with a certain style. But Qigong's many forms, they're more slow and gentle, one by one. They don't need to follow 10 movements continue. You can do 1 or 2 individual movements. So the patient also sometimes personality and their medical conditions. Some patients are reasonably well, for example, early stage case patients, stage 1 and 2, for cancer patient, they can do normal activities, even though they can go gym and they do swimming in the beach. But when they go stage 3 or stage 4, when they're very tired, and also depend on some people are very, during the treatments, very sensitive to drugs. They're very, very sick. Some people reasonably well. So based on many conditions, that's why we thought Tai Chi Qigong instructor have to understand medical conditions, and then they can modify their forms. So you also mentioned that I know that in early 1960s, Guilin Qigong was very famous in China. Since then, still popular, but there's one forms. But when you do research, of course, in China, there's many Guilin Qigong they follow, but in Western world, there's many different Tai Chi and Qigong they've done research. They show that many different Qigongs are very effective, but depend on population. But there's no comparison among the Tai Chi and Qigong, which one is more effective. So sometimes, of course, when you do research area, of course, the funding, when you write a grant application, you cannot difference the Yang style Tai Chi, Chen style Tai Chi, and comparison. I mean, actually, we can do practically, but when you do write scientific research, we like to see sample size calculation, what's difference, effect size, many issues. That means we need 1,000 sample size. We are recruiting, it takes 10 years to recruit the 10,000 population to compare. So another, the research issues as well. So we know that if the patient have a choice, and the practitioner offering many programs have many choice. But for the meantime, sometimes patient, they don't have a choice. What is available, they can try. There's other things. Yes. But more important, main message is a lot of patient, as long as you enjoy and you start well slowly, and people get a benefit. Yes.
Thank you. Thank you.
Yeah, thank you. Your question?
Next, let's ask Donald Wong to ask a question.
Thank you very much. I heard you talking about the gentle Tai Chi and the Qigong. Myself, I've been practicing since 1965. Internal and external Qigong and Taoist Tai Chi. But I have looked at other styles, and the thing that I'm afraid of people relying on Tai Chi is some people are just showing the form and not the breathing aspect of the Tai Chi, which is very important, because the breathing is what moves the Qi around in your body, not only
Yes.
just the moving. And the difference with Eastern and Western medicine, Eastern, I see most of the people visit doctors to prevent from getting ill, where in the West, they see the doctor after they've been injured or sick. And the other thing people have to understand, once they do the Tai Chi or the Qigong, they have to be careful, because when they start to detox, sometimes they feel more pain, and they have to get over that part of the detox before they get better.
Yes.
Go ahead. Yes, please.
Yes, I think you mentioned about two important things. One is the breathing is important, and the other part is treatments. When you go treatments, yes, I think that's why I mentioned about the Tai Chi Qigong was a different method. And then also that initially when you go in the community Qigong Tai Chi programs, they are more focused on movements. not so many people, of course, some people who's very experienced, the Tai Chi master, they know that higher level, they will discuss about breathing exercise. But most of them, they move 80% program more focus on the movements instead of breathing exercise. But when you go to the Qigongs, more than 50% people, they know that breathing is very important. Sort of like sometimes that's why we call them combination. We are confused with the meditation and Qigongs. Qigong is very slow and gentle. Sometimes we do movement. Sometimes without movement, we do Qigong exercise. Sometimes I call them Qigong meditation. For example, I also teach the Qigongs. A lot of people, when you do a meditation, they says, a lot of cancer patients, they says, after 5 minutes, they fall asleep. Then I call them, oh, then you try my Qigong meditation. I ask them, close, hands on sitting here, visual hands on breathing in your hand and breathing out, relax. Visualize energy coming from the lower abdomen. When you're coming in, breathing in, and you go down, breathing out, relax. Once your mind focus on your palm, of course, you will not sleep because you are moving, you are calm and relaxed, and you're happy, but your mind is still aware of your body. Later, if comfortable, slowly breathing out. You don't need to go high, whatever you feel. Of course, a lot of patients after breast cancer patients, after surgery, they cannot move, breathing in and breathing out. You don't need to do 1,000 movements. You feel and relax. Later, if you practice 1 week, you feel nice sensation on your body and your palms. So then, whatever you create relaxation, that's what you need. That's one thing. That's why we call them in the Qigong. Once you start breathing exercise, you're starting already 50% of benefit you can get. So breathing exercise is very important in addition to all movement. And next one, as mentioned, yes, as mentioned earlier, Eastern philosophy, of course, always, not only Eastern philosophy, Western medicine, public health, we always mention prevention is more important. But this is a theory, and public health, they're aiming for, they says, instead of curing one patient, curing 1,000 people. Of course, this idea, but how we can implement, how we can introduce Tai Chi Qigong. Yes, this idea, that's what we like to promote. Once you promote Tai Chi Qigong, not limited on Tai Chi Qigong, we call them as this mind-body exercise, Tai Chi Qigong, yoga, meditation, relaxation, Pilates, whatever, all these gentle exercise, if you can promote, people practice every day, at least 10 minutes a day, people can improve many medical symptoms, they prevent disease. So that we have to promote, so that I think our associations, that's why we create Medical Tai Chi Qigong Association. In the last 5 years, we invite academic research and promote our research to general public as well as healthcare practitioners. So both parties, patient understand and healthcare practitioner, they can understand what is current evidence, they can recommend, people practice, and they get a benefit. So we can prevent many diseases and reduce medical costs for the governments. And also, I think Larsen's organizing now direction to improve public health. I think I'm very pleased to hear that Larsen is organizing many good researchers on the Tai Chi Qigong research area. They're inviting, and I'm sure many people in YouTube, they'll watch this event, and they will know that Tai Chi Qigong can improve many medical conditions and improves their well-being and health. Yes, thank you. Any other questions?
Wonderful. I think we have a question in the chat from Austin Jackson. I don't know if would you like to ask your question, or should I read it aloud for you?
Yes, I cannot see it, but if you have whatever questions, either you can read or speak to me.
Go ahead, Austin.
Hi, Dr. O. I'll just read the question as I wrote it. Thank you very much for your presentation. My question is this. Research shows that some or many patients benefit from regular social group interactions. This might include Tai Chi as a group activity. Does the research control for this variable? Does the research consider Tai Chi practice as an individual activity? If not, I'm wondering how it's possible to determine whether Tai Chi benefits come from the exercise itself or from Tai Chi as a form of social activity.
Yes, I think your very scientific questions. Thank you so much for your questions. Yes, this is another things our researchers around the world, they are on discussions. But only thing is that some people, when we have a good research funding, we have 1,000 people or 500 patients, then we can control all the individual, we call them confounding factors or bias variables. Of course, lifestyle, age, what they're having the food, how many hours they practice in addition to Tai Chi and Qigong, what other things. Of course, a lot of patients, especially for example, in cancer area, they do Tai Chi, also they do yoga, they do walk, they go around half an hour walk in the park. Many things they do in addition to activity, Tai Chi, Qigong. So that all individual variables, some people, they do only 1 or 2 activities. Some people do 5 activities. So as mentioned, some people, anxiety, depressions, psychological symptoms also very important to improve quality of life. Of course, if you have something, that's why we call them, when you have good friends, they invite you, have a coffee, have a nice cake. Of course, after tea and coffee, people have happy. That means, of course, we know that they improve the quality of life. But that's why sometimes, in addition to we are measuring subjective measurements with the quality of life questionnaire or the psychological outcome with the questionnaires, we are trying to measure biomarkers related to something we can measure, objective measurements. So previous research, they measure immune markers, antioxidant level, or inflammation biomarkers. So now I'm aiming for microbiomes, many things. So that we're trying to show them objective measurements in addition to. That's why when you have a randomized clinical trial, of course, sometimes there's many case study, we are not sure what causing in addition to Tai Chi and Qigong. But when you do randomized clinical trial, the big sample size, we can control for many other factors. Then we are aiming for the essence effect of Tai Chi Qigong. So that that's why we have to see latest research with the good research, with a good research design, and we know that many they control many factors. So that in future, when you go individualized programs, that means we need more research on this area. At the same time, we need more funding. But as you know, sometimes not easy to get funding for individualized programs compared to group programs. There's another issues. Yeah, thank you.
Thank you.
Well, I think we are just reaching the end of our talk today. I would like to share one more comment that came into the chat from Kathleen Gill, who unfortunately had to leave a few moments ago. But she says, thank you, Dr. O, for your wonderful presentation. As a psychologist in psychiatric and medical settings and Tai Chi and Qigong player for 40 years, who shared these practices with patients without this definitive research, it is so validating to see how far the research and support has come to this present day. And I think I'd like to share with her in thanking you so much for coming to us tonight from virtually and sharing with us these fruits of your research, which are so important and are really leading the way to something wonderful. So thank you for spending your time with us today. Thank you to everyone who's come here to join us tonight. And we'll be looking forward to seeing you again in the future. And again, thank you so much, Dr. O.
Okay, thank you. Thank you for your kind invitation again. Thank you for all who joined for tonight, and hoping to see you in one day face-to-face in our conference in near future. Thank you.
Thank you.